Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Aficamten or Metoprolol monotherapy for obstructive hypertrophic cardiomyopathy. Background. Beta blockers have been the initial treatment for symptomatic obstructive hypertrophic cardiomyopathy, HCM, despite limited evidence of their efficacy. Aficamten is a cardiac myosin inhibitor that reduces left ventricular outflow tract gradients, improves exercise capacity, and decreases HCM symptoms when added to standard medications. Whether Aficamten as monotherapy provides greater clinical benefit than beta blockers as monotherapy remains unknown to conclusions. Among patients with symptomatic obstructive HCM, Aficamten monotherapy was superior to metoprolol monotherapy in improving peak oxygen uptake and hemodynamics and decreasing symptoms. Next article. Mavacamten and symptomatic non-obstructive hypertrophic cardiomyopathy. Background. Mavacamten is approved to treat adults with symptomatic obstructive hypertrophic cardiomyopathy, HCM. However, its effects in non-obstructive HCM remain uncertain to conclusions. Among patients with non-obstructive HCM, Mavacamten did not result in a significantly greater improvement in peak oxygen uptake or decrease in symptoms than placebo. Next article. Multidomain rehabilitation for older patients with myocardial infarction. Background. The benefit of rehabilitation interventions in patients who are 65 years of age or older, with myocardial infarction and impaired physical performance remains unclear. Conclusions. Among older patients with impaired physical performance 1 month after myocardial infarction, a multidomain rehabilitation intervention resulted in a lower incidence of cardiovascular death or unplanned cardiovascular hospitalization within 1 year than usual care. Next, we will be discussing articles from Journal of American Medical Association. Biparametric versus multiparametric MRI for prostate cancer diagnosis. The PRIME Diagnostic clinical trial. Question: is biparametric magnetic resonance imaging, MRI, non-inferior to multiparametric MRI in the detection of clinically significant prostate cancer? Findings. In this Level 1, prospective, multi-center, within-patient, non-inferiority trial of 490 biopsy-naive men, biparametric MRI was non-inferior to multiparametric MRI for detection of Gleason grade group 2 or higher prostate cancer, difference, minus 0.4 percentage points, meaning in men with suspected prostate cancer, provided that image quality is adequate, an abbreviated biparametric MRI, with or without targeted biopsy, could become the new standard of care for prostate cancer. Next, we will be discussing articles from Annals of Internal Medicine. Exposure to CT and pregnancy outcomes. Background. Animal studies show ovarian follicle damage and mutagenesis after ionizing radiation exposure. Computed tomography, CT, imaging is commonly done outside pregnancy, but risks to future pregnancy are unknown. Conclusion. Exposure to preconception CT imaging may be associated with higher risks for spontaneous pregnancy loss and congenital anomalies, but causal mechanisms remain to be elucidated. Alternative imaging methods should be considered when appropriate. Next, we will be discussing articles from British Medical Journal. Second cancers in 475,000 women with early invasive breast cancer diagnosed in England during 1993 to 2016. Objective: to describe long-term risks of second non-breast primary cancers and contralateral breast cancers among women with early invasive breast cancer after primary surgery. Conclusions. The risk of a second primary cancer in women treated for early invasive breast cancer is slightly higher than for women in the general population. Contralateral breast cancer accounts for around 60% of the overall increase, with higher risks in younger women. The risk associated with adjuvant therapies is small. Next, we will be discussing articles from Lancet. Benefit-harm trade-offs of intensive blood pressure control versus standard blood pressure control on cardiovascular and renal outcomes. An individual participant data analysis of randomized controlled trials. Background. Although intensive blood pressure control is recommended by major guidelines, its overall benefit-harm balance remains uncertain. In particular, it is unclear how net clinical benefit varies by blood pressure target and patient characteristics. We aimed to quantify the benefit-harm trade-offs of intensive blood pressure control versus standard blood pressure control. Interpretation. Compared with standard blood pressure control, intensive blood pressure control provides a net benefit between the reduction in cardiovascular events and the increase in adverse events, including renal events. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from JAMA Oncology. Debt, bankruptcy, and credit scores after cancer diagnosis. Question: how do financial outcomes, debt and collections, credit scores, and bankruptcy change over time after cancer diagnosis compared with a control population? Findings: in a matched difference in differences analysis of 74,146 individuals with a cancer diagnosis and 74,146 control individuals in Massachusetts, it was found that medical debt in collections worsens for years after cancer diagnosis. Total debt in collections, credit scores, and bankruptcy rates did not differ after cancer diagnosis, meaning there is evidence of mild adverse financial outcomes that persist for years after cancer diagnosis despite high rates of insurance coverage in Massachusetts. Here are the articles from Journal of Clinical Rheumatology. Pilot Study, Development and Evaluation of Validity, Evidence of a Low-Cost, Low-Fidelity Hand Model to Teach Clinical Assessment of Small Joint Swelling in Inflammatory Arthritis. Objective: to create an affordable, easily reproducible, low-fidelity hand model, and present a validity argument for its use to support residents learning to identify inflammatory arthritis. Conclusion: content validity evidence supported our model's use in internal medicine training. However, the model needs improvement for greater construct and predictive validity. Our easily constructed, low-cost hand model may be a promising introductory training tool for rheumatology medical education. Next, we will be discussing articles in the field of cardiology. Here are the articles from Journals of the American College of Cardiology. Trajectories of angina after initial invasive versus conservative strategy for chronic coronary disease. Background: clinical trials typically report average health status outcomes by treatment at single points in time, as opposed to participants' trajectories or journeys over time. Although Ischemia, International Study of Comparative Health Effectiveness with Medical and Invasive Approaches, demonstrated better mean health status at discrete times, with an invasive treatment among those with baseline angina, the patterns of individual participants' angina over time are unknown. Conclusions: patients with chronic coronary disease and angina experienced diverse symptom trajectories, ranging from rapid resolution to severe or persistent angina. A greater proportion of conservatively managed patients experienced unfavorable angina patterns over 2 years, compared with those treated invasively. When health status is monitored over time, such patterns may help identify patients with persistent symptoms who could benefit from additional therapy. From JAMA Cardiology. Polygenic Prediction of Peripheral Artery Disease and Major Adverse Limb Events. Question: how does a polygenic risk score, PRS, perform in estimation of peripheral artery disease, PAD, and major adverse limb events? Findings: in this cohort study of 3 populations, a new PRS was significantly associated with PAD and stratified risk for incident major adverse limb events. Addition of high PRS, top 20%, to guideline-recommended screening criteria increased the proportion of identified cases of incident PAD. meaning polygenic background shows potential utility in primary and secondary prevention of PAD. However, further research is needed to optimize performance in non-European populations and determine its associated effect on vascular outcomes. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. YAP1 is a prognostic marker and its inhibition reduces tumor progression in adrenocortical tumors. Context: adrenocortical cancer, ACC, is rare and aggressive, with YAP1 overexpression associated with poor outcomes in pediatric patients. Objective: in this study, we investigated the mechanisms by which YAP1 drives ACC progression and explored it as a potential target therapy. Conclusion: YAP1 is a potential novel prognostic marker in patients with ACC. Its deregulation contributes to adrenocortical tumorigenesis partially through crosstalk between Hippo/YAP1 and WNT/beta-catenin pathways. YAP1 inhibition is a new anti-tumor target. Here are the articles from Diabetes Care. Glucagon-like peptide-1 receptor agonists, and the risk of emergency department visits and hospitalization in patients with chronic kidney disease. Objective: the aim of this study was to evaluate the effect of glucagon-like peptide-1 receptor agonist, GLP-1 versus dipeptidyl peptidase 4 inhibitor, DPP-4I, initiation on emergency department (ED) visits and all-cause hospitalizations across the spectrum of kidney disease. GLP-1 initiation was associated with a reduction in all-cause ED visits and hospitalizations compared with new use of a DPP-4I. Next, we will be discussing articles in the field of neurology. Here are the articles from Neurology. Association of polygenic susceptibility to hyperlipidemia with cholesterol control and recurrent stroke in ischemic stroke survivors. Background and objectives. Common genetic variation significantly influences the risk of stroke, and previous research has indicated that polygenic susceptibility to hypertension and diabetes negatively affects the clinical trajectory of ischemic stroke survivors. We hypothesize that polygenic susceptibility to hyperlipidemia, PSH, negatively affects cholesterol control in the same population. Discussion. Among acute ischemic stroke survivors, higher PSH is associated with worse lipid control and higher risk of recurrent vascular events. Our findings, combined with existing evidence on the role of adverse genetic profiles in blood pressure and glycemic control in this population, support the comprehensive evaluation of polygenic profiles as a cause of failed risk factor control in stroke survivors, and its role in developing precision medicine tools for post-stroke clinical management. Next, we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Association of timely spirometry with lower all-cause mortality. Background. Although spirometry is the gold standard for diagnosing COPD, it is underused in clinical practice. Research question. Which factors are associated with timely spirometry at chronic treatment initiation in a clinically relevant population of people starting chronic treatment for respiratory symptoms? Is this diagnostic test associated with lower mortality risk? Interpretation. Only 1 in 3 initiators of chronic treatment for obstructive lung disease underwent spirometry. Spirometry was particularly underused in primary care. Especially, never smoking, female participants and vulnerable patients may be at increased risk for underdiagnosis and suboptimal treatment. Importantly, spirometry at treatment initiation was significantly associated with better prognosis, possibly through better tailored care. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Risk factors for patient-important upper gastrointestinal bleeding. Rationale. Patient-important gastrointestinal bleeding is an endpoint developed by patients and family members. However, risk factors for this outcome are unknown. Conclusions. Several factors are associated with the risk of patient-important upper gastrointestinal bleeding during invasive ventilation. Next, we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology: Pregnancy and Long-Term Kidney Function in CKD. A systematic review and meta-analysis. Outcomes for women with mild CKD are reassuring. Pregnancy does not impair long-term kidney function in mild CKD. Women with advanced CKD should be informed on risks of losing pre-pregnancy kidney function in pregnancy. Animal studies support clinical findings in mild CKD and offer insights in the potential underlying mechanistics. Here are the articles from Kidney International Reports. Meta-analysis of randomized controlled trials on gamma-aminobutyric acid analogs and opioid-based therapies for CKD-associated pruritus. Introduction. Chronic kidney disease, CKD-associated pruritus, CKD-AP, is one of the most distressing symptoms of patients with CKD, adversely affecting their quality of life and survival. This study aimed to investigate the efficacy and safety of gamma-aminobutyric acid, GABA, analogs and opioid-based therapies in patients with CKD-AP. Conclusion. Our results suggest that GABA analogs and opioid-based therapies, particularly difelikefalin, have significant potential in alleviating itch intensity and improving the quality of life of patients with CKD-AP. However, opioid-based therapies, especially those involving mu receptor antagonists, such as naltrexone and nalbuphine, are associated with a higher incidence of AEs or ADRs. Given the substantial heterogeneity observed in most of the results, interpretation should be approached with caution. A systematic review of sleep hygiene strategy in CKD. Introduction. Sleep hygiene strategies are often encouraged in people with chronic kidney disease, CKD. We aimed to summarize the existing evidence on sleep hygiene strategies in this population. Conclusion. This review showed that sleep hygiene education can be a useful strategy for improving sleep in people with CKD. Exercise and relaxation techniques may reduce sleep disturbances. However, further research is necessary to determine the optimal timing for these activities.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.